Thank you, Professor Arit Chica and Dr. Steve Payson for inviting me to give this talk for the Society of Government Economists and in cooperation with the Association for Integrity and Responsible Leadership in Economics and Associated Professions. And thank you so much, Professor Beth Geertz and Professor John Mulley and Breno Braga for hosting us for this panel on new developments in health economics in the pandemic era. And I want to focus my introduction talk today on COVID-19 long haulers, and thereby I want to especially pay attention to the democratization of health and healthcare information and the economics of prevention, e-health, and rest. We can say from the history of humankind that pandemics were often turning points to a better future. During the 14th century, the Great Plague actually was the starting point for the Renaissance. We saw healthcare and hygiene standards improving drastically. The lack of labor really drove people to embrace mechanization and figure out how technology can replace missing human power. And values of the Renaissance came out after the pandemic, self-determination, but also democratic sharing of ideas. Within our current pandemic, I detect that there is potentially a pandemic within a pandemic in the long haulers. As you can see, as of today, over 3 million coronavirus infection cases have been reported, but in this figure, potentially 5 to up to 50% of unreported cases are represented, and there are already prospects with the different variants that almost all the world, 80 to 100%, will be infected over the course of their lives. What we can also already now see during this pandemic, that there's this phenomenon of long haulers, and those are people who have 6 to 12 weeks after an infection with coronavirus, lingering or changing symptoms, and about 10 to 50% of COVID infected are believed to become kind of long haulers who need longer time to recover from this virus. And when you now think that almost all the world will at a certain point in their life have a touch point with the coronavirus, and 10 to 50% of coronavirus infected become long haulers, you can calculate that 0.6 to up to 3.976 billion people will become long haulers. And this is the pandemic within the pandemic. This pretty much equals the size of 2 to 12 times the US population, or when you count it for the US population, it is estimated that 27 to up to 166 million US people will at a certain point have longer term problems from a coronavirus infection. There seems to be currently a formation of 3 different clusters of symptoms that can be overlapping, but long haulers are comprised of the ones who have organ damage. For them, potentially transplants will be the way out of the health crisis. We have people who show remaining viral loads, who keep on being sick after a while, and then recovering and then becoming sick again. And there seems to be also a cluster of people who have overshooting immune responses. It's like in a Lyme disease that never, where the virus clears, but the immune system starts attacking the tissue, human tissue itself. And there's hope, especially for the ones with the overshooting immune system, that the symptoms might fade. And here about 18 months are needed for the recovery, often This is pretty much the normal distribution for the immune system to calm down again. If we now say that this phenomenon is quite new, so right now we have over 200 symptoms that are associated with COVID long haulers. This is multiple problems from fatigue to loss of taste, headaches, brain fog, heart conditions, inflammatory diseases, and skin and gum problems, but also psychological impairments, sleep disorders, post-traumatic stress syndromes, depression, anxiety, and fear are among the top mentions what long haulers go through. What we already also in this new forming disease nomenclature, we see that especially 70 to 75% of long haulers are female in the medium age of 40 to 42 years old. And what this will potentially lead to, I speculate that 3 trends will emerge out of this crisis. On the one hand, we have with COVID-19 an acknowledgement that no one is safe until everyone is safe. So you have this highly transmission of a virus, and you really have to get the entire world free or cured or bettered or better protected from the virus. And here the vaccinations come in. We already see a renaissance of the TRIPS agreement, the trade-related aspects of intellectual property rights, which became really prominent in the 1990s with other pandemics that help that you can uphold intellectual property rights in vaccination and medication advancements. But on the other hand, you have extra clauses and conditions where you grant access to affordable medical care to places in the world that cannot afford health care and cannot afford to pay for high costs of health care. We see also a telemedicine revolution, access to affordable health care that is corruption-free. I will speak a bit more about this in a minute. And especially what is prevalent with these long haulers is that currently when there was this time when people were urged not to go to the hospital, or people were naturally afraid to go to the hospital, a lot started to happen in social media about exchanging information about long haul issues that were not as dramatic to go to a hospital, but still kept people so unhealthy that they were urged to find each other in social media. Of course, the question here arises: this information exchange of debilitated people. Do we have a proper privacy protection? What do we do with advertisements on social media that potentially become aggressive or target vulnerable populations in these long haulers? In big data, we try to find solutions, not only the prevention, but also the cure. We see in the EU the effort to really set positive market incentives to share information and share data. But again, data sharing should only be for the benefit of patients under the assumption that patients are a vulnerable population in pain or in cognitive impairment, and we really also need to see more regulation and thinking about how to protect people from scraping data or putting it together for market purposes. The second trend that I speculate about is the medical revolution in the prevention. We already saw when the crisis broke out that there was this idea of healthcare and prevention, hygiene in cities. We saw safety, ventilations, glass and air ventilation became really a focus of corporations at every place where people need to work together. Liability issues became a topic. Consultants were hired. The World Economic Forum spoke about the Great Reset and also spoke about about more thinking how corporations can make us healthy. We have already in Europe, for instance, we have this Prevention Act where the government actually subsidizes corporations for trying to keep the workforce healthy. And I see this as an advancement of growth theory when you start learning by preventing together in teams in the workplace in order to be more productive and efficient. On the de-urbanization, we saw that people really moved out of cities. They formed these agro-hoods or cottage cores where people live together in harmony with their environment. In architecture, we saw a boom in biophilia designs. People like to live close to nature, and they like to have their surrounding, their interior design really resembling nature. And we saw this revolution of sustainable clothing. COP26, a lot of people say the breakthrough was in sustainable clothing in the latest climate summit of the conferences of the parties. We also see, especially with the long haulers, that there's attention to prevention and prevalences, and really thinking about a holistic approach. We already see obesity declared as a pandemic, throwing you into a certain trajectory once you get infected with coronavirus diseases. But we also see now with the long haulers that a really healthy nutrition seems to be a key that they can fully recover. And I think we will see more work on this, especially that we also have the long haulers really driving trends of alternative trends on social media, where they exchange information, what works, what does not work. And a lot of the solutions that are promoted should be easy, over-the-counter, cheap solutions when people exchange freely information and are not driven by pharmaceutical companies or the medical profession. So we see this trend already, and it will potentially also change the monitoring, oversight, price mechanisms in the medical sector. And lastly, I think that there will be more and more the trend towards e-health and monitoring of the state of the body with these long haulers who often have symptoms that come and go in waves. We see that preventive medical tracking is important, not only for your own body and your own functioning, but also a preventive care in terms of how is the environment. We already have apps created that scan the environment for viral loads and scan your body for viral load early responses, so you would know where if you're exposed to a virus, and you could leave a situation earlier before you get infected. Big data insights are on the rise even before the pandemic, and with this we also see a mapping of devices in order to evade privacy infringements of sick patients. There's more of a cartography of medical devices than really actually being or collecting data of vulnerable populations. Overall, in economics, I see a change to lifestyle changes. Economics might become more cognizant about the importance of rest, the importance of recovery, of minimalism. We see as behavioral economists, you can argue that the world is too complex already, and you want to have more minimalistic approaches in order to save and secure people from being in a state state of cognitive overload, especially if waves of symptoms occur and concentration comes and goes in waves. We potentially will see more artificial intelligence and robotics helping long haulers in these waves of productivity, shifting to waves of being exhausted. So AI and robotics will hopefully fill in. And overall, I expect that we will see more attention in economics to inclusion, to realize that people might have changing or might have a spectrum of productivity and debilitation, and not only a spectrum in society that might become different with this wave of long haulers, but also within a human being, that you have days where you can function and other days where you cannot function that well. And then potentially this will really change the way we structure our lives, our productivity, and our workspace. I just want to leave you with some data snapshots on the e-health. I made this argument that digitalization can help as a corruption-free tool to bring access to affordable medical care. In a paper, I argue that for good medical care, you need economic prosperity on the one hand, freedom from corruption, digitalization will help, and market capitalization. And what that comes down to, I started plotting data together. First, I did an index for digitalization or artificial intelligence prevalent in a community or in a country, and gross domestic product as a measurement of productivity. Here you see the darker the country, the more internet connectivity and GDP you have. Then I phase in corruption, which is measured by Transparency International. And then I also phase in global connectivity. And what that comes down to is here, the greener the country, the better the country performs on anti-corruption, global connectivity. And then I phase in into this corner where I say these countries are leaders on good and on a good level of digitalization, and a very good state in terms of anti-corruption. When you phase in healthcare, it looks like this. So the greener the country, the better the country is performing on artificial intelligence, digitalization, anti-corruption, but also healthcare accessible. And I think these countries that are greener lighted should be able to lead the world in terms of healthcare solutions that come online and that help to lift up communities in their medical care, in their fair access to quality care, but also in prevention and living with a body of people who potentially have longer term problems from the coronavirus. Lastly, market capitalization definitely also helps. And here you can say that US is really leading in getting funding for breakthrough new innovations. So take these different shades of the world as a starting ground where and what countries could help to evade the next crisis. Overall, in economics, I do think that we will see more of healthcare influencing productivity research. We potentially will have to open up or ingrain the idea of only a healthy country can be productive, and what does healthcare do to the actual Keynesian multiplier? Can we even have growth if the healthcare sector is not up and or if the population is not healthy? Can we have multiplying effects in an economy? And here I want to end it with a future vision of economics of rest and recovery. So in the summer, we heard so much about governmental funding and rescue and recovery aid. Right now, about 60% of all the funds ever spent in the US are allocated towards rescue and recovery bailout funds. So $900 billion in the US are considered to be given out in the next decades. But in this largesse of amounts that are granted for rescue and recovery aid, we also have to consider the point of Angus Deaton and Anne Case, which we see here, who got actually the Nobel Prize for making this argument that you have to slice up aggregated data. So Professor Anne Case and Professor Angus Deaton at Princeton University argued that some part you have to aggregate numbers about health and well-being and life expectancy. You have to open them up and see who is affected by what kind of policies. External shocks potentially have a disparate impact, and especially COVID-19 on the long-term horizon. We can say that potentially female, but over also around middle ages have potentially a prevalence to become more affected. And what does this mean for the overall social security and retirement plans? Do we have to rethink this, and do we have to schedule differently accounts, knowing the fact that female in the middle age brackets might be affected more on a long-term basis by coronavirus crisis? And the very last point I want to make, bring it back to the overall start of the presentation, when I argued that crises also have always the positive externality to be mobilization of large-scale new innovative trends and actual betterments. So we saw this in the Renaissance, and potentially the new Renaissance of our time will be large-scale funding projects like the Green New Deal or the European Green Deal that bring people closer to nature, the environment, and a healthy lifestyle that also focuses on preventive care. In the future, I do envision that there will also be a values change, and that will also come from economics. At the World Economic Forum, Janet Yellen, the Secretary of the Treasury, spoke about inclusive growth. The US is at the forefront to innovate that economic growth is not only about productivity and maximization and welfare improvement overall, but it is also about zooming in and seeing what kind of groups are impacted and affected in what kind of way, to really shed light at the disparate impacts. And there, I think the future lies really in law and economics of the disparate impact, and in economics of inclusion that accept that the differences, that see it as a potential and as a growth potential when you embrace the differences within society, but also between, or not only between people, but also within the individual, that potentially will see more different states of sickness and health, productivity, and the need for rest and recovery. With this, I really look forward to discussing these thoughts with the colleagues from the society and the audience.